Hi, everybody. Today, this is actually a very important topic. The reason why I say that is because, a lot of people don't realize if you are pre-diabetic, not only diabetes, but pre-diabetic, listen carefully, pre-diabetic, you could have what they call a peripheral neuropathic, your numbness, and you will have that starting a beginning of getting nerve damage, and you cannot feel the lower extremity nerve. So net result, you're going to have issue which you might not even think about. And since you are not getting a habit of start examining and you massage your foot or whatever, eventually, as time goes on, you are actually getting yourself a big problem, might even potentially losing your foot. So I thought that perhaps today I want to share this message with you so you start learning, because it is a habit that you need to start working with, okay? So a lot of people don't realize that, and I thought that as time move on, we want to make sure that you guys have that knowledge base. 各位朋友，我係 Andrew Lowsutea President。嗱，點解今日我講呢個咧？係喺個糖尿病裏邊咧，係關於個神經慢慢會係由是呢個普通嘅神經系統係由是喺身體嘅側邊，好似腳嘅側邊啊，嗰啲 sensation 叫 peripheral， 即係你身體出邊喺側邊嘅地方咧，係會有感覺上咧開始越整越少嘅。咁呢個咧係一個東西咧，你可能即係現在係未必咁感覺啊，但係你知啦，你糖尿病唔係今日噶嘛，係一路咁落去噶嘛，係咁多年噶嘛。如果你唔開始了解咧，咁有可能即係最後咧，你係唔知道病咗，然後即係整傷咗，咁令到你嘅腳咧係好有問題，你都唔知，咁你就好弊家伙啦。所以咧，今日個重點係好重要嘅，講嘅今日嘅 topic 好重要嘅。咁希望你哋大家多啲了解咧，就多啲防禦。咁下個禮拜咧，我哋希望再講深入啲啦，等你點能夠知道點去睇住你隻腳，點能夠保護你隻腳啦。呢啲我哋繼續會講多啲。但係最重要今日講咗呢個係乜嘢嘅問題先 ？OK， 即係周邊嘅神經系統。點解會忽然間越整越冇感覺咧，或者少啲感覺咧，同埋個跡象係點樣咧 ？So today I think the meeting is so important because it helps you to understand what is peripheral neuropathy, which is really a starting of getting your nerve start getting numb and so forth. So we will talk about that. So give me 5 minutes just to catch up, because today we have people from United States, Philippines, Hong Kong, Singapore, Malaysia, all different places. And many of these people are new to us, so I just want to catch up with them. So we'll start the webinar now, and then we'll go from there. Okay, I'm going to catch up real quick just to give you some idea what we're talking about. Now, as you know, diabetes is a chronic disease. You never get well. All you got to do is control. You cannot get well. Believe this. And it will affect your entire body blood vessels. That is the most scariest thing, because every body, entire blood vessel, you will be, involved. And then you will the only thing you can do it is you have to control your blood sugar and don't let it get over. For example, your A1C cannot be over 6.4. And if you are pre-diabetic, it's the same thing. You have to not necessarily, to make sure your A1C doesn't go over 6.4. If you are diabetes, you got to drive your A1C from 10+% all the way down to 6.4 or lower. And don't stay at 7 and say, I'm satisfied. It won't work, because you have to continue to drive this blood sugar all the way down. Now, how do you do that? Dieting is very important. So you have all the time low carb diet. You have to exercise. You have to weight management control. You have to continue to control your diabetes. And then with that, also one good formula is drinking Lowsutea to help you to continue to lower blood sugar. You cannot eat white food, soda, juice, all those things has to be eliminated, or at least drink very little. And that's the only way you can do that. So carbs diet is low carb diets is going to be essential to rest of your diabetes journey. exercise are extremely important. Control weight, measure your blood sugar. All those things are part of it. Now, the question is, how are you going to become a diabetes? In a sense that there is 4 stages. The first stage is basically your cholesterol sugar is going to get thickening, and your blood starts thickening. And unfortunately, when your cholesterol goes up and blood sugar, both will damage your pancreas B cells. So the B cells are not able to carry the sugar into the cells. So without no insulin sugar taking out, your sugar can go up. And then, but since the blood sugar and cholesterol are become very thick, you will start forming all the plaques onto the vessels, and that will be continued throughout your body. So that will be the stage 2. And your blood pressure usually go up because the plaques are forming all over the vessels and getting less small area on the vessels. And the third stage is you continue to do whatever you want to do, your blood sugar can go up. That will be your third stage, will be pre-diabetic. Your A1C will go from 5.7 all the way to 6.4, and that will be your third stage. And if you don't do anything, you don't control, 4th stage diabetes. 嗱，各位堂友，有4部曲係會變咗糖尿病。嗱，除咗講咗啦，糖尿病永遠唔好嘅，你一定係要靠你自己降低你嘅 A1C 由10 all the way to 6.4。如果你唔降低咧，咁一路上去咧就好大問題出現啦。咁其實糖尿病咧，第一個部曲咧就係你膽固醇 LDL 上咗嚟啦，你糖又上咗嚟啦。咁兩樣嘢都係損壞你個 B cells 嘅個胰臟嘅 B cells。咁 B cell 冇咗 B cell 之後咧，佢帶唔到啲糖入去個細胞裏邊啦。咁你啲糖咪繼續高咯。咁同埋仲有一個最大問題，啲血咧變咗好結啊，咁變咗嚟講咧，佢就form好多啲血塊喺個血管，成身血管都有喎。咁你第二個部曲咧就係你血壓就會上升嘅。第三個部曲咧就係因為你啲糖繼續高啊嘛，咁你個血管啊樣都開始硬化，咁咧弊家伙啦，你個 A1C 咧就會一路咁升上去。A1C 係6點會係6.4，由 5.7 去 6.4， 5.7 至 6.4， 所以變咗嚟講，如果你繼續唔做嘢咧，一過咗 6.4 後咧，咁你就變咗糖尿病第四個步驟啦。所以呢個4個咧係個人都會一樣咁行過晒嘅。OK， 如果你係糖尿病者，所以記住好重要，要控制血糖啦，同埋膽固醇。OK。咁其實點解去糖同 work 咧 ？Why you drink Lowsutea work? Because one Lowsutea actually block your sugar absorption because the guava leaves here through the vessels after you eat. They go into your gut and the sugar will be blocked, absorbing into the vessels. And the bitter melon is a magic thing. It will act like insulin, give you a booster, like go take the sugar into the cell because it act like insulin. On top of that, bitter melon will also take the sugar out the body with your with the urine because really interesting. It doesn't allow the sugar reabsorb back to the body. Plus, it dump up cholesterol and sodium out to the body. So that's wonderful. So net result, that's why a lot of people say, wow, how do I get my, even I eat my medication, drugs doesn't come down, my blood sugar doesn't come down, even with all of diabetic. But after drinking Lowsutea works because that what happened is I give you the insulin booster. 嗱，點解去糖茶會 work 咧？因為第一佢有番石榴葉咧 block 到啲糖入去血管裏邊。第二咧佢有個苦瓜咧就將啲糖咧好易胰島素帶啲糖入去細胞裏邊。仲有一個好嘢咧就係佢係能夠令到啲糖咧同埋膽固醇咧同埋啲鹽咧喺個尿嗰度掉出嚟。咁所以兩樣全部啲嘢咧都係幫你成身嘅糖降低，膽固醇降低，同埋咧你鹽降低。咁最後咧，你就個身體咧就會好多人飲咗之後腳腫都唔見埋啊！咁啊，嗰就係咁嘅原因啦，因為佢抌鹽都掉咗出嚟，咁你血壓又會降低啊，同埋你會繼續排毒啊，咁啊飲咗之後咧，你會去世界多咗嘅。Okay, if you do not do anything, a sad part is it has tremendous amount of body damage. What's that mean? First of all, your body damage is your blood sugar will go up, your risk to get stroke, and net result, your eyes, because they plug up all your vessels in your eye, you're going to have glaucoma, you have got cataract, your eyes become blind, become blur, your pancreas will malfunction, and it will no longer issue insulin, or insulin so high. Your insulin resistance so high, the insulin will not work anymore. And you certainly 40% of many diabetic patients will get heart problem, heart disease. At 40 to 60%, it depends where you're at. A lot of people with risk of heart disease. And then the nerve damage. Matter of fact, 60% majority of the people will have nerve damage, some form, severe to light. So you really cannot ignore this part. And today we'll talk a lot more about that. And then we have high blood pressure is always very much many of those. And then if you're in your foot, you're going to amputate. And a lot of people also have diabetic nephropathy, which would mean you might end up to do dialysis. And then 30% of the dialysis patients have no sex function, no sexual function. So they're really sad. And pregnancy, if you are gestated diabetic, if you don't take care of it, you might have complications. And that is really, really sad. So all that will come together. You have to be very, very careful. 嗱，我哋同係其實咧血糖嘅高血糖嘅併發症係好多嘅。如果你唔處理咧，係一定會繼續喺度嘅。第一有個中風嘅風險啦，同埋咧眼會盲啦，開始睇唔到嘢啦，青光眼嗰啲啦。咁同埋個胰臟開始壞啦。如果胰臟開始壞咧，弊家伙啦，嗰啲胰島素唔 work 啦。咁你40%啲人咧，好多都有呢個心臟病嘅。咁其實咧，呢個亦都係一個好大嘅問題。同埋 nerve damage 咧，60% 嘅糖尿病者有 some form of nerve damage 嘅，咁係嚴重或者輕微都係會喺度啦。咁血壓高又好高啦。同埋咧，如果有咩真係如果你真係你大髀係嚴重啲嘅，你個整親腳嘅時候咧，可能腳咗佢啦，哇！真係好慘喎。同埋洗腎咧，亦都係好多人會 end up 呢樣嘢。咁仲有咧，30%嘅人咧係冇咗呢個叫做性功能嘅。咁所以呢啲就係全部都係一個好慘嘅東西啦。咁所以變咗嚟講咧，希望咧大家即係注重咧控制。咁變咗嚟講咧，呢啲嘢咧就最低係降低你個 risk 你個風險啦。OK。咁我哋公司咧其實好重要嘅啫，其實希望咧就幫你哋咧。係降低血糖，咁你如果你係前期患病者咧，你都唔會變咗糖尿患病者，或者你糖尿患病者咧，你唔會有呢個糖尿嘅併發症。So our company objective is really holding a hand and to basically to help pre-diabetic patient not to get convert to diabetes if they're pre-diabetic. If they're diabetic now, we hope that will teach you how to lower your blood sugar so you don't get diabetic complications. Delay all that. So there will be 5 programs. The program will be including low diet, carb diet will teach you how to do that. We'll teach you how to exercise. The second program will teach you how to weight control. We have Doctor Examined. We'll teach you how to measure blood sugar. So all that, hopefully your A1C to come down from 10% all the way to 5.7, or you are pre-diabetic, will not get you to over 6.4. So you continue to lower your diabetes risk. So this is our objective. And basically the 5 program will be very important. So I hope that all these webinars help you understand. 嗱，各位朋友，我哋咧做咗幫助你係降低你血糖之內咧，就希望你能夠咧。係唔會由前期轉為糖尿病啦。如果係糖尿病就唔會有好多糖尿病嘅知道之後咧，幫助降低血糖，又唔會有好多併發症嘅風險啦。同埋我教你點樣去食一啲low diet 好啲嘅 diet 嘅食物啦，去 exercise 啦，去 weight control 啦，點減低磅數啦。同埋咧，仲有我依家個禮拜都有個 seminar 俾你啦。咁你就更加多了解，每個禮拜都知道啦。咁pretty soon 咧，你就知道好多嘢點控制自己，因為呢個長遠病啊。如果你自己聽下唔記得咗咧，你冇咗個 motivation 咧，亦都係唔會去 control， 咁就弊家伙啦。咁同埋咧點去度你血糖啊，咁令到你咧更加係 好嘅血糖，咁變咗你就冇咗呢啲咁嘅風險。So it's so important to have this long-term working together, holding your hand throughout this diabetic journey, because this is a lifelong disease. And if you are not being motivated or follow through to lower blood sugar, it's going to be sad that a lot of people actually end up become from low blood sugar, go back to high up sugar. So then they get all kind of problems come along. Okay, so today we're going to talk all about the diabetic peripheral neuropathy. Now, this is a way to understand how you prevent that and what does it mean and how do you treat it, basically. So, and I think last week was good to talk about like Alzheimer's disease, diabetic, dementia, all that. And basically, all these are related now, as you know, right? It become more understanding related because it decreased your nerve sensitivity because your blood sugars are high and screw up your brain, screw up your peripheral nerve circulation. All that are all related. That's why I'm going a whole series of helping you to understand what does it mean. 嗱，各位同友，嗱，記得琴日兩日咧，我哋講過咧，第一個腦退化症同埋咧有 Alzheimer 嘅 disease。點解咧？就因為糖喺個腦度咧塞晒所有嗰啲神經系統，咁呢神經系統就唔識話俾你聽，喂我痛啊，邊度唔舒服啊？唔識啊，因為佢塞住晒啊，佢冇咗營養啊，同埋啲 nerve 開始 die off 啊。咁同埋仲有一樣嘢咧，當你係好個糖一路繼續高嘅時候，亦都令到你腳啊，除出邊啊，個周圍嘅周邊嘅神經咧係開始會冇咗感覺，冇咗感覺咧弊家伙啦，有任何嘢咧就會令到你咧感覺唔到，咁好多併發症就繼續出現啦。咁希望今日咧呢個講座咧，令到你了解多啲咧，咁最低限度咧，你會知道點樣能夠幫助你係會有個防禦性啦，同埋點樣醫治。OK? So first of all, diabetic peripheral neuropathy is some form of nerve damage, basically, because it crossed by basically just continue high, basically high nerve, high blood sugar all the time, and then net result you have nerve damage, and this is the most common things in all diabetes, and because of that, even if you are continue to be in diabetic journey, this is most likely you will be one of the victims if you are not controlled. Even pre-diabetic patient will get that too, because I can tell you a lot of pre-diabetic patients who have A1C around 613, they start notice things that start changing. So you don't think that, well, only diabetic patient will have that. I am examined. Well, that's not true, because you are now in this group are moving toward that. And the change are very minimal. Start out with dry skin, feel a little bit numb, and things like that. So you will have continued high blood sugar, then your nerve damage will slowly approach it. And 60 to 7% of diabetic patients will have eventually developed some form of peripheral neuropathy, nerve damage, okay? And this nerve damage cannot be reversed. In other words, if you damage the nerve already, it don't come back. So you gotta be starting that early to control it, okay? So this webinar will give you all that insight to help you understand what is the risk and how to decrease this risk and how to prevent you developing nerve damage and keeping your blood sugar in as close as possible as normal, okay? Now, 今日講座咧，其實對好重要嘅，好多人唔明白咧。原來咧，如果你係糖尿病或者前期患病者，都有機會咧開始咧係會一路落去咧，你個神經系統會損壞。當你神經系統損壞咧嘅時候咧，咁你嗰啲神經系統咧就會開始壞啦。 當你開始壞嘅時候，弊啦，咁變咗嚟講咧，就會開始你啲神經唔會感覺啦。咁變咗嚟嘅，原來60至70% 咧嘅糖尿病者咧都係有依個問題嘅，同埋仲有如果你唔控制，一路整落越壞咧就翻唔到轉頭嘅，記住。所以其實依家希望你早啲知道咧，就早啲控制，咁你啲 nerve 咧唔會繼續 damage， 因為 damage 咗就唔翻轉頭噶啦。So keeping 你個 blood sugar 係有即係 in a good level 係好重要嘅 ，OK， 即係 normal level 啊，即係正常嘅糖尿嘅嘅 level 係即係血糖嘅 level 係好重要嘅。So really at the end of the day, we really need to put all effort to control your blood sugar in the normal level, because this webinar will teach you all the reason why, but really because 60 to 70% of diabetic patients will eventually develop this. So you really got to take steps how to prevent and how to prevent you getting worse. Once the nerve damage cannot get kept back to normal. So you want to start now, prevent that to continue being worse nerve damage. Then your peripheral neuropathy will get worse and worse and worse. It's really sad. Okay, so you want to prevent that. So I would say that first of all, diabetic can damage your peripheral nerve. We'll talk about that. We'll call the typical people will call it DPN, Diabetic Peripheral Neuropathy. This is the common, they will call, in people, doctors, they usually use DPN is the way to describe that. And peripheral nerve damage, basically, it started off as like your leg become numb, your feet become, sometimes they're feeling pain or cold, and it affect both basically your feet and leg first, okay? And then eventually it might go into the hand. You feel your hand, it start getting, wow, you know, my feeling is not there anymore. And you will have also odd feeling of the skin and muscles. And sometimes you get numbness and don't realize that you have foot injury because you have no feel, because the nerve is not there. Now, that is really, at the end of the day, I found also pre-diabetic patients. Some of them even started that. And so if you say, hey, I'm only pre-diabetic, I don't worry. Well, that's not true, because net result, you will start feeling somewhat dry skin, a little bit numbness. You kind of not, you got to have really don't have a good feeling of your feet. And that is always the beginning, even you are pre-diabetic. I have a lot of patients already asked me they're only pre-diabetic, they're 6.3 of A1C, but they already feel that the leg is start getting tingling, feeling, they don't feel, you know, not the same anymore. They feel something is kind of dry, you know, they describe many feelings as numbness and dry is the common description for pre-diabetic. And then as time goes on, when they become truly diabetes, they also have that getting worse and worse and worse. So I heard this many times now. So you really got to take this, not only say, wow, I'm a pre-diabetic, I'm no worry. That's not true. So you got to keep that in mind. 嗱，各位堂友，記住，因為咧，當你係糖尿患病者嘅時候咧，你係好多時咧係會覺得啲腳咧開始係會有 numbness 啦，即係好似冇乜感覺咁啊，或者感覺要 take 好耐先感覺到啊。咁啊，同埋咧，仲有咧係會有啲痛咧，有陣時亦都有如果好凍好熱啊，未必有感覺到啦。咁同埋咧，仲有咧就有陣時咧就手腳都有嘅，唔係淨係腳手都有嘅，可能嘅。咁同埋咧就好多人就話我好似即係有啲好怪嘅feeling 喺個 skin 度啊。咁同埋咧啲muscle又有唔同嘅感覺啊咁所以變咗嚟講咧，好多時咧因為你冇咗呢個感覺咧，你整親隻腳都唔知。咁同埋咧好多時咧前期患病者咧就以為哇唔關我事啦，因為呢個係糖尿病嘅啫。但係好多人前期患病咧就開始第一樣咧就話哇我隻腳好乾喎，我開始有少感覺咧係感覺唔到喎，或者係 好得意喎，唔知係即係個形容到咧就好似哇咁我要好耐先感覺到嘅，咁呢啲咧就係個跡象咧開始啦。So very important, you have to identify all these little things. Why, what happened, the feeling of your foot, okay? And so if you identify that, you need to right away taking notice and notify your doctors about that's happening. Now, really on research, they know if you are pre-diabetic or diabetes, why you have the peripheral neuropathy. The reason is because your blood sugar continues to be high, it's damaged your nerve, and you have basically interfere your body ability to send signal to the brain to tell them that, hey, you know, you have some injury or you have some feeling. So all those things become very, very slow. On top of that, your triglyceride in the blood also become high, and that also causes nerve damage. Now, also because of high blood sugar, all the small vessels that go to the brain, it doesn't provide because stuck. You know, remember when we talk about if the vessel become more narrow, plugged up, and up, you have difficulty to get food to the brain. The vessels are stuck up, so supply to the nerve with oxygen and nutrients become substantially decreased. So all that will cause the nerve become less sensitive. Eventually, some even died. Once it died, can't go back. So net result, you have diabetic peripheral neuropathy. Basically, that's how it works. 嗱，糖尿病周邊神經病嘅變化咧，個原因就係因為糖可以繼續高噏，即係已經好高啦。咁佢成身嘅身體咧，所有嘅血管去到腦嗰度咧，嗰啲signal 去唔到啊，個腦去唔到，話俾佢底下，喂，我隻腳有少唔妥喎，感覺唔到。咁所以變咗嚟講咧，當個腦係冇咗啲氧氣啊，因為佢糖塞住晒微絲血管嘅時候咧，好多腦嘅細胞係攞唔到氧氣同埋營養，咁啲細胞就可以死咯喎，咁失咗功能咧，弊家伙啦，咁呢就翻唔到轉頭噶啦。咁所以變咗嚟講咧，同埋仲有好多時咧，就係你個膽固醇三脂油高咧，又係同樣係損壞你嗰個神經系統嘅。咁呢啲咧就係喺真係喺嗰個研究裏面咧睇到，哇！如果係咁樣嘅話咧，你個神經系統一路咁損壞落去咧，咁你開始就好多嘢都感覺唔到噶啦。So very important, you have to continue to find out your feeling of, you know, testing a foot, right? Because 60 to 70% of diabetic have some kind of nerve damage, and that is a high percentage. You know that? And then especially a long-term diabetes. In other words, you know, I'm 60 years old or 50 years old. Now I'm 70 years old. Then you have 20 years of diabetes. The chances of DPN is going to be high, especially if you are pre-diabetic first at 40 years old, and eventually 50 years old. All those things are coming along with obesity, overweight, diabetes are getting high, lots of metabolic syndrome is start coming in, and usually called the 3 high, meaning the high blood pressure, high blood sugar, and high cholesterol, and high belly fat. All this is going to actually move you a closer chance to get DPN. So basically, you got to understand, condition DPN you actually could control, but you don't do anything early, you set yourself up for DPN. 嗱，各位朋友，記住咧，喺糖尿病裏邊咧，60至70% 嘅病人咧，都多數有呢啲咁嘅即係不同嘅程度上嘅神經嘅損壞嘅。咁其實咧，如果你係已經有20年嘅糖尿病症咧，其實 DPN 咧係好高噶啦，已經開始，因為咧你糖繼續高嘅時候，一定有三高啦，你血壓高啦，你血糖高啦，仲有你個膽固醇高啦。如果你有呢個三高嘅話咧 ，chance 係你會高好多嘅 DPN。咁所以咧，其實點解我咁早話，一定要早啲話俾你聽，咁你開始控制到咧 咁就會對你個神經損壞越整咧就越少嘅。So important, really gotta go early, understand this so you can actually to control and decrease the chances to get DPN. Okay, so what is the sign and symptom of DPN? Okay, so the really common sign and symptom, which is very common, majority of people have that. Matter of fact, some of the pre-diabetic patients already starting that is they usually get numbness. Now, that can be recognized. Well, I don't know. I mean, my foot is still feeling kind of not the same anymore. You know when it takes longer to get feeling. You know when you step on and I don't feel right away, I'll take a little longer. So that's the reason is because that feeling is because your nerve cannot communicate to the brain that fast anymore. So a lot of pre-diabetic on this change, and this change will take 1 year maybe or 2 years, but you can see progressively seeing this change. So a lot of that pre-diabetic patient, I can tell you, many of my clients right now in our group actually ask that question. You know, my feet kind of feel funny and now it's not the same anymore. And I said, hey, you know, you got to really watch this because diabetic DPN might be one of the potential problems. So you have to check with the doctor to really continue to monitor that. And so people don't alert, then they might not know. So numbness, tingling feeling, or pain, or like a burning with a needle feeling, like people poking your feeling, your foot, your finger, you know, that kind of feeling. And you might feel, even sometimes some people will say, wow, you know, just touching sheets, you know, your bed sheet, you feel pain when you sleep. And then if you get worse and worse, your muscle become worse, especially area of the ankle, you have difficult walking, you're painful coming along, you start losing balance. And then, you know, all that can start coming on. As time goes on, things will get worse. Actually, even have bone deformed, it will be totally, you know, your bones start getting deformed. And some of them even have no symptom, but it's suddenly start, okay? So net result, you need to start monitoring that because remember, diabetes is a lifelong disease. You have to continue to monitor your every change. That's why I said you have to continue to measure your blood sugar because a lot of people don't measure blood sugar. You don't know. And so with that, at least you can get a sense that, wow, my blood sugar continue to be very high. Now I get numbness of my hand, tingling feeling of burning. Wow, you got to know that, wow, maybe DPN is already started and how can I control it? Because once you get damaged, it don't reverse. So got to catch it early. 嗱，各位朋友，呢個周邊神經系統損壞咧，好多時咧就係你會覺得隻手咧開始有少少麻痹啊，冧冧地嘅。咁你感覺上咧就好似咧好似腳點樣地咧，要 take 一啲時間先可以感覺到。咁呢啲係好常見嘅第一樣 feeling， 唔係痛嘅，係即係有啲好似唔知點感覺好特別啊，我感覺唔到啊。咁有啲人咧就會有少少嘅 tingling feeling， 即係好似刺刀刺地佢咁個針刀咁嘅，有啲係咁嘅。但有啲咧就係有啲仲有咧係有啲係覺得隻腳會痛啦。就算有陣時瞓覺咧鬥嗰個床單都痛嘅，呢啲亦都有嘅。更加差嘅時候咧，咁個 muscle 咧，即係肌肉咧就可以好 weak 啦。咁行路都有問題。咁同埋咧，仲有行路有問題嘅時候咧，你個 balance 咧平穩嗰度咧，亦都有問題。咁有陣時亦都係冇症狀。咁所以變咗嚟講咧，就唔好話我好似有少 numbness 冇乜嘢嘅啫。其實一路慢慢落去咧，越整越差嘅。咁你有依樣嘢嘅時候，你開始正視睇下你糖係咪繼續係差，因為好。繼續差嘅時候咧，咁你就要好注意呢樣啦 ，OK？ So really the most important is to catch DPN early. As you know, you want to create this to prevent any type of complication, okay? Because keep in mind, DPN, you can't get well, but you can only control at that point. So if you can control early, that will be super. So very important. You have to check, with the doctor once you start getting all those symptoms, which I should mention earlier. You got to understand, wow, DPN is here. I better control myself. Now, on top of that, as you get older, in other words, if you have diabetes, like I'm 55, I got inflammatory diabetes, or I already pre-diabetic, now I'm 65, 10 years later, maybe as you go older, your diabetes get worse. So you got to continue to control that diabetes, okay? So let the doctor to check the DPN and make sure that even though you have no symptom yet, but check on it. So make sure that you are really doing well, because you don't want to start getting, say, wow, hey, I'm already DPN and how can it be, get worse, okay? So do check with your doctor early to stop the progression of DPN. 嗱，記住各位朋友，我哋 DPN 咧一定做一樣嘢咧，係早啲發現同埋早啲控制。因為如果你唔有個控制咗去策控制咧，就弊家伙啦。因為好多時咧，就算你有啲呢啲咁嘅 symptom 啊，有啲咁嘅即係開 numbness 啊，你又唔話俾醫生聽喎。咁尤其是你到老啲嘅時候咧，你個 DPN 預警會差嘅。咁如果你唔早啲 catch on 呢樣嘢，控制咗佢咧，就嗰啲第時咧一落去嘅時候咧就預警弊啦。咁有陣時咧，你可能連即係一啲症狀都冇嘅。咁所以變咗嚟講，你繼續係要 watch 呢樣嘢啦。咁要 check 你個 sugar 係咪繼續好高咧？咁呢啲咧就係真係要每一個人都要自己控制。Now, how the doctor examine your DPN? Usually, the most likely the doctor who examine DPN will also start off with the feet and leg. Okay, doctor will look at circulation issue. They will look at see you have any cut or sores. They will ask you to walk, so you have balance walking, and then they also check that can you sense your temperature, cold and hot, and then are you able to feel touch or any kind of vibration, and they will also ask to touch your toe and feet, see all those feelings is there. So the doctor will start examine, most likely DPN was from your foot first. And that's very important because if you have all that, maybe your DPN is just started. So you can able to control, right? So this is a common doctor examination of DPN. 嗱，各位堂友，當你見醫生嗰陣時，你話有 DPN 咧 ，most likely 佢開始第一樣 check 咧就係你手腳啊，手腳就好重要先嘅，多數睇腳噶啦。咁佢會睇下你個腳嘅血脈係咪循環咧有冇問題咧？裏面有冇一啲疏咧？有啲即係傷口咧同埋瘡咧唔會好咧？同埋會叫你行下俾佢睇下你有冇lost balance 咧？同埋佢俾啲凍水俾你感覺有冇凍水咧？或者熱水啊感覺有冇熱水咧？咁同埋你感唔感覺到震盪啊？同埋鬥你腳嘅時候有冇着啊？咁同埋咧。最緊要咧，你嘅腳趾有冇感覺啊，或者腳有冇感覺？呢啲佢係初期咧，一定係咁去睇你個睇下你有冇 DPN 嘅，醫生一定係咁做先嘅。咁同埋咧 ，so second thing besides all that, they will check your blood and also to check your urine test and check blood sugar. Definitely, you see was blood sugar real high. They will also check the triglycerides. So make sure it's a high triglyceride. And also, they will also check, your whole sort of your blood profile, because with that, they also potentially you have kidney disease because of diabetes. Also, could be thyroid problem, infection, cancer, and also all the other things they will check. Like for example, are you lack of B12 vitamin levels? Are you alcohol abuse? Things like that, or you are AIDS patient, because AIDS patient also have some of this symptom. So all that it will come from what? Checking all the blood work, and doctor besides doing the physical check, they also do your blood work. 嗱，各位堂友，個醫生 check 嘅時候咧，佢 check 幾樣嘢。第一，佢睇咗你感覺上嘅東西，你腳東西。第二樣咧，會要 urine test 啦，即係尿check 你尿啦，亦都 check 你血啦。 咁呢啲嘢咧，全部要睇下你喂血裏邊有冇其他問題咧。For example， 你個三焦嚟知啦，你有冇其他嘅血糖高啦？咁同埋咧，仲有其實其他嘅問題咧，都好似你依家有糖尿病嘅問題。嗱，腎係一個好重要嘅，好多時腎病亦都有同樣嘅問題出現嘅。有個甲狀腺亦都係個同樣出現啦，所以你唔可以撈兩晒有隻腳 feel 唔到就一定係糖嘅，都有呢啲問題嘅。咁仲有好多時咧，就係你係咪有癌症啊，或者你有不嬲飲好多酒啊，咁飲酒亦都令到腳係感覺唔到嘅喎，或者 B12 維他命 B12 好低，亦都有呢個問題嘅喎。仲有呢個 HIV 即係你個如果佢係HIV 嘅問題咧，咁亦都有啲病人係有呢個問題感覺唔到嘅咁所以變咗咧，就呢啲咧係會喺即係愛滋病啊，係會令到有可能咧係會都係呢啲咁嘅感覺，所以咧佢唔會話即刻咧就如果你係冇感覺之中咧就係你一定係糖尿啦，因為有呢啲其他嘅東西咧都係令到你咧會可能喺個感覺上係冇咗嘅，所以一定係要睇血液嘅血液測驗嘅。嗱 ，just now I already very much stressed. Once the nerve damage, unfortunately, it cannot be reversed. In other words, you cannot say, "Wow, nerve damage. I'm now stopping. Doing exercise. I stop my blood sugar going high. I now control my blood sugar, and I'm doing good." But on the hand, you know what? Once the nerve damage, the treatment, no matter what you do, it cannot reverse. It will just control stop progression at the time. So you really got to work together, very much so, with your doctors, how to further control, not to get your nerve damage to continue to get worse. Now, certainly the doctor might give you drugs like antidepressant or seizure that, because a lot of people will say, "Oh, I feel pain all the time with the DPN." So with the antidepressant drugs, seizures, those are the drugs can help you to decrease your DPN pain. And also keep in mind, over-the-counter painkiller usually doesn't work with DPN. So the doctor will also might suggest some kind of physical therapy to you so you get better feeling. And most important, you have to continue to move. Those are the real most important treatment that most likely, why you keep moving is good. You know why? Moving increase what? Circulation. So when you have more circulation, the chances of DPN progression will be less because when you circulate, you're getting food, nutrition, blood sugar, all kind of stuff going back to your nerve. So you are maintaining that nutrition to the nerve, so the nerve not become to die off and prevent it continue to damage. So very important, work with your doctor. 嗱，神經損壞咧好重要咧，你知道咧係一損壞咗個神經死咗咧就唔會生翻嚟啦，咁就會係永遠都係嗰度噶啦。咁其實我依家希望各位知道呢樣嘢之後咧，就開始去控制啊。咁點控制啊？第一，你可能醫生會俾藥你食啦，聽醫生講咩啦。嗱，有啲人好痛嗰啲咧，就可能會俾一啲即係藥咧，令到你係會更加開心啲嘅。咁個痛咧就會減低咗嘅。咁但係如果好時你話要食其他好似 Panadol 嗰啲，未必 work 㗎呢個。咁同埋咧，仲有咧，醫生會可能要你去做 physical therapy 啦，即係呢個物理治療啦，亦都有啲 exercise 俾佢做啦，可能會好啲嘅。但係好重要一樣嘢，繼續喐。如果你唔喐嘅話咧，點解喐好緊要啊？因為喐咧，你係繼續將啲食物啊、糖啊，俾到你個腦嘅神經系統，咁同埋腳出邊嘅神經系統，越喐咗啲係越好嘅，所以 exercise 係好緊要。當就你係能夠控制，俾你唔會更加差。呢個係繼續做呢樣。This is one of the important treatment is really continue to keep moving. So this is something that you can do by yourself all the time. Now, one of these things, and this is a very important, a picture that you have look at it. The reason is because majority of people start getting infection, even don't even know about it. Because most of the infection that people have problems are started right here. You see this little thing here, your foot pressure. And a lot of time because they cannot see this area. So this area, your superficial blister, a cut, a wound, and don't get well. And worse come to worse, it become a deep ulcer, and it still don't get well. Damage to all the way to the bone. Eventually, the whole foot become gangrene, and gangrene, you end up cut out the foot. So a lot of people don't realize this is something you have to be really every day using a mirror to check bottom of your foot. So ensure to know your foot are not in trouble. Now, this is something that a lot of people don't know because they figure, well, I don't see it, because you don't feel it either, because your peripheral nerve are damaged, so you don't feel much. So, and when you are pre-diabetic, a lot of pre-diabetic also feel that, wow, I feel funny over here, but they don't know what that is. They feel a little bit, but not that, and the feeling of delay. So all these things over here is very important. You have to watch, because this is a lifelong disease. You got to be really, really be careful, because you have diabetes, you have poor circulation, your wound have difficult to heal, it'll heal very slowly. Eventually you have serious infection. If you don't carry your wound or don't get it to get well, it then become a deep ulcer. Eventually you get the gangrene, you lose your foot or your leg totally. On top of that, the bunion here is another area that most of the lady will have the issue. So this is that's why the shoes, you have to don't get scratched on a bunion, and then that will be something that will be really detrimental to your foot. So very important, you have to really be careful, and that's why I put this chart here to let you know what you have to look for. OK， 嗱，周邊神經系統損壞咧，好多時咧就係隻腳嗰度開始嘅。腳開始咧，最重要咧就係 make sure 咧，你唔好話喺依度隻腳前期患病者同埋糖尿患病者好多時都有依樣分離嘅。佢撳落去嘅時候咧，你感覺慢咗好多啊，感覺唔到。如果佢真係有呢個 Dpn 嘅時候咧，糖尿患病好多時喺依度淨冇感覺。咁當你冇感覺嘅時候咧，咁你譬如有個腳嘅瘡啦、blister 啦，或者損壞 cut 啦，咁你其實咧就冇咗感覺嘅。咁如果依啲嘢開始發炎咧，就弊啦，因為發炎之後咧就會係開始唔會好啦，一路唔好落去咧就開始有個 deep ulcer 啦，一個好深嘅嘅瘡啦，然後去到骨啦，咁整下咧你隻腳咧就冇咗 circulation 之後咧就會就病死啊，就咁咧你就弊家伙啦，就失去咗成隻腳。咁呢個咧就係常見嘅問題嘅，所以一定要好注重咧，每日咧睇下隻腳係咪有呢個 injury 喺度，呢個有冇即係呢咁嘅瘡啊？咁其實喺呢度咧側邊嘅腳呢度骨嗰度咧個賓人嗰度咧，亦都係常見有問題嘅，所以呢啲係一定女士咧亦都要好注重啊。So when you have severe neuropathy, the problem is your bone start also deforming, and so your foot is not only become red and hot and swollen, warm to touch, and also very cracked. This is also very common, and because of nerve damage, you don't feel, so you basically don't even know what that happened, and it start affecting your bone. And a lot of times the bone become deformed, and that result you can even start losing balance, and the doctor will basically need to even give you a brace to ensure your foot doesn't continue to deform that you can't even walk. So you might need special shoes to make sure to support your walking. So all that has to come from the doctor that provide you this kind of help. Okay, so you really have to especially when you get worse, this is gonna happen. So you gotta make sure you gotta start watching all that. 嗱，各位朋友， 當你有個嚴重啲嘅神經變化咧，你嘅腳咧開始係冇感覺乜滯嘅。咁變咗嚟講嘅時候咧，你譬如有咩譬如紅腫發炎，或者係已經係你感覺上係好 hot warm to touch 咧，即係直哇好熱喎，即係依個已經發炎啦。咁同埋咧可以嘅皮膚好乾咧，可以有好多 crack 啊 break， 即係有啲裂痕啊。咁嗰裂痕咧就可以會有發炎啦。因為你冇感覺嘛，咁你咪又唔痛。咁或者你唔痛嘅時候咧，咁你亦都冇知道要做嘢。咁弊家伙啦，變咗好多時咧。越整越差嘅時候咧，你可能嗰啲骨折啊同埋個崩咧就可以直情唔妥 deform 咗嘅時候咧就弊啦。咁好多時咧你行路都有問題嘅。咁好多時咧醫生係要俾個護罩你隻腳啦，個 brace 去俾你行路啦。咁同埋咧仲有咧可能要即係行唔到咁多，你就要早啲休息啦。咁所以其實咧對鞋亦都好緊要嘅。咁遲啲。個鞋一定要好大頭鞋啊，嗰類啊，尖頭鞋唔 good 嘅，繼續磨隻腳咧係唔 good 嘅，所以變咗嚟講咧，你就開始咧做呢樣嘢咧，要好多即係睇住隻腳啦。So when you have this really severe case, you now need to really treat yourself, make sure that doctor know maybe you have a braced shoes and you have to take a lot of rest of your foot, make sure you have increased circulation.So carrying your feet become very important to treat the DPN. So what's that mean? So in other words, you have to always look for cut, burns, sores of feet that because you have no pain. So you have to keep looking yourself, especially a bunion. Don't wear real long, sharp shoes. It's not going to good for you. So you have to continue to basically look at your bottom of the foot all the time.Make sure that it is not, you don't have any kind of injury on the bottom of the foot is so important. On top of that, you have to wash your foot daily, maybe with warm water with 90 to 95 Fahrenheit or 32 degrees C. Get some Epsom salt to soak your feet so your feet become always nice and moist. And you put cream on it to give you ointment to keep it moist, so it won't prevent crack.Blister, those are very, very important treatment for your feet. And you have to massage your feet also. And so net result, you can able to increase the blood circulation. Massaging your feet is really good every day if you can do that. And what I'm saying is also move to wiggle your toes, moving your toe. So again, this is all, part of your sort of foot care, healthy foot care. Not that in Hawaii, especially, I noticed we have a lot of friends from Hawaii with, Gordon, Eugene, wearing a barefoot or barefoot at home might not be a good advice. You got to wear shoes because you don't know what happened to you, you injure your foot. So it's good to wear socks, and you can change your socks every day. Thick socks is good because you have cushion. And especially when you're cushioned with shoes are much more protected besides accidentally injure your foot. And when you train, even trimming your toenail has to be very careful. You have to cut across, not cut at end, so cause additional injury. You want to key is here is prevent any potential infection occur. And you see the infection, see a doctor as soon as you can. 各位朋友，因為咧喺呢個 caring 你嘅即係保護隻腳咧，點解咁重要咧？因為好多時咧你已經冇感覺啊，所以任何嘅 injury 咧或者損壞咧、損傷咧，你係感覺唔到嘅。咁當你有呢樣嘢嘅時候咧，你感覺唔到咧，咁你底下隻腳嘅時候咧，哇弊家伙啦！譬如有啲嘢整親啊，你感覺唔到就可以發炎啦。所以其實咧，每日咧。其實最好咧，你可能夠揾啲軟水，再加啲 Epsom salt 啦，去縮下隻腳。咁然後佢 massage 隻腳，俾啲 cream 喺度，去服侍下隻腳。咁你隻腳咧嗰啲 circulation 好啲啦。咁同埋喐下腳趾啊，更加多喐下。咁變咗嚟講咧，你就可能夠更加多啲 circulation 喺個腳底嗰度。咁每日都要做啊，每日都搽 cream 啊， 每日去咩massage隻腳喎，咁呢個係一個十分重要東西嚟嘅。咁同埋咧，仲有咧就唔好唔着鞋。嗱，好多時咧，你知喺屋企咧，依家香港人都好中意啦，唔着鞋喺屋企。咁但係呢個唔好嘢嚟嘅，點解咧？你屋企唔夠你踩親啲嘢，損壞咗，損咗隻腳，咁你可能咧就會發炎啦。咁我提議咧，仲要買啲厚啲嘅襪咧着啦，咁同埋每日都換呢個襪，咁你就可能夠令到你嘅減低你嘅即係腳嘅個injury 咧，會係好重要嘅。咁同埋咧，你剪腳甲咧直剪，唔好剪埋側邊嗰度。好多時就係因為呢個咧就increase 咗你嘅 injury。咁如果有發炎咧，就話俾醫生聽。OK，so very important. DPN has to come from you daily treating your foot. And as mentioned, one of my previously when I was in Hawaii, one of my Japanese patients, she is a very nice lady doing yacht work. She lost her foot is because of one little twig put into her toe, and the toe didn't get well. Eventually, a few months later, she lost the entire foot up to the ankle, just only right here, because the circulating become poor, so poor that she's losing her foot. So take that very seriously. I still remember so many years ago, I still remember her case. So keep that in mind. Continue to make sure prevent your foot become injured. So wearing proper shoes to protect your feet is so important. Make sure your shoes become big front, round front, not very narrow. You want to make sure your shoes become very comfortable and plenty room for your toe. So your regular tennis shoes is very good, but make sure that it give you plenty support in the front. And your doctor might even give you some suggestion the kind of shoes you should wear, how to become comfortable. Make sure the shoes are thick enough, can protect you from hot and cold, especially people who are living in a cold area. You got to make sure that the foot is thick enough to prevent too cold, that the coldness to absorb into your foot and burn your foot in cold. Then end up you have cold burn, and that's something a lot of people don't remember. End up they can become, because of that, they might lose their foot because of that. You also need to make sure the foot has no rough edges, like leather shoes that can create a blister, injury, and friction. End up you will not well, and you will cut off your foot. Wow, that would be very sad. Okay， 所以鞋咧好緊要嘅，鞋一定要有啲大頭鞋啦，或者醫生會俾特別鞋你着啦，同埋咧仲緊要你鞋一定要好舒服嘅鞋，唔好買啲鞋咧唔舒服嘅。尤其是喺凍嘅地方咧，冬天啊，你哋買鞋要夠厚啊！如果唔係咧，嗰啲凍氣咧、熱氣都係嘅，可以能夠 injure 到你腳，你咪唔知啊嘛。咁嗰啲一弊啦 ，injure 咗之後有發炎，咁同埋咧你就會 end up 即係 lost 隻腳，因為咁嘅情況。我見到喺外國喺美國係見過晒呢啲嘅。咁同埋咧，仲有咧鞋一定要好舒服啦，唔會有啲硬嘅東西令個鞋你個腳損壞啦。咁呢樣嘢亦都係對你十分唔好嘅。Now, also, your peripheral neuropathy can also cause nerve damage to all the other area of the body, including your eyes, because your nerve damage could go to the eye, other blood vessel, control. A lot of people even have problem with the bladder. They cannot control the bladder. They have problem with stomach, other body function, hip, butts, walking, difficult moving. And so more really is affect your nerve on your leg, hand, and sometimes could be your head and chest and belly. So all that can be potential. So really is not only leg and foot, but also affect your other body. So gotta keep monitoring that to really make sure understand that this neuropathy is not only your leg and arm alone, it can affect the entire body. 嗱，記住咧，原來神經變壞咧，其實可能夠成身都會有嘅，可能有眼啦、血管啦、你膀胱啦、個胃啦、其他嘅身體嘅五臟啦，同埋好多時咧就令到隻腳啊、手啊、可能頭啊、肺啊、個大肚墩啊，呢啲全部都可能有影響嘅，所以咧唔好 take it too lightly， 真係呢樣嘢咧係要繼續努力啊。So really at the end of the day, when you map the, when you really come up to a conclusion, is most important is to manage your blood sugar. If you manage your blood sugar well, the long term create nerve damage, the small vessel will be lessened. So you really has to be very early, make sure your blood sugar is always normal range, and then you lower your chance of DPN and all the typical complications. And certainly you gotta keep taking your diabetic medication, like your metformin, whatever you take it, or you need insulin, take insulin. And really you need to drink Lowsutea to continue keep up your blood sugar in a normal range. Now, certainly more important, you have to have dieting, exercise, weight control. All these are so important, plus maintain normal blood sugar and decrease the 3 high. What is the 3 high? Blood sugar, cholesterol, and what? The 3 high, blood sugar, cholesterol, and blood pressure. 3 high, you gotta keep that low. With that, the chances for you to have high chances of, if you can control that, your diabetic DPN will be basically a substantial decrease that risk. So very, very basic. Just start off controlling your blood sugar. Now, a lot of our clients now are already in there. I can tell you many of my patients already have been in this stage in managing their blood sugar extremely well. So they are very good with the control with the blood sugar. And so net result, the chances, what I mean control blood sugar, the A1C was 10 all the way down to under 6%. They are very well controlled. So they are always there now. So you can do it. I saw in my own eye. It's not saying, hey, I'm diabetes, that's it. No, you can control because they're drinking Lowsutea, taking a medication, the diabetic medication. They were there. I saw it with my own eyes. So go do it. It works. So keep that blood sugar in the normal level. I saw it and it does work. So I encourage you, everybody should have that objective to do it. Okay? 嗱，各位朋友，最緊要咧就真係咧降低你血糖，令到你嘅血糖水平咧係喺一個好嘅水平裏邊，即係 under 你個 A1C 6.4以下啦 ，average blood sugar 應該係 under 7或者6.5嗰啲地方啦，或者係 under 120嘅 milligram per deal 啦，呢個係一定係你繼續努力嘅做法。咁如果你當你係繼續係你嘅糖嘅人 level 係 good 嘅話咧，個 chances of 你嘅 DPN 係會好少嘅。咁同埋仲有咧，你係可以能夠咧令到你嘅身體其他嘅損壞都繼續低翻落去。咁同埋咧，仲有咧，你繼續要食你嘅糖尿病藥啦，要飲你嘅打胰島素啦。如果要打胰島素嘅話，同埋飲你嘅去糖茶啦。飲你去糖茶之後咧，你血糖一定繼續降低嘅。咁仲有咧，你繼續要做你嘅 dieting 啦，即係你嘅食物嘅控制啦，你要 exercise 啦，仲要 weight control 啦。咁呢啲咧全部係好重要嘅，即係你磅數啊，繼續努力去 exercise 啊，咁同埋繼續度你血糖，因為如果你唔度你血糖咧，未必知你原來好高嘅。咁最後咧， 千祈唔好繼續俾你三高，即係話你血糖高、你膽固醇高同埋你血壓高，呢三樣嘢都係 no good。So make sure 呢啲係全部降翻低，俾佢一個平穩嘅 level 咧，咁呢個咧就會幫助你降低你DPN 嘅風險啦。So in summary, as you know, 60 to 70% of us diabetic eventually can develop peripheral neuropathy or DPN, a nerve damage, okay? And this nerve damage can be caused by mainly high blood sugar all the time. And most common diabetic really affected, if they are diabetic, many of the diabetic patients are being affected DPN or some form of DPN. So you have to control it and make sure that once you become a DPN, at that stage, you don't get well. You're just not progressing worse, okay? And even pre-diabetic patient, you will get it too, but the severity is just not as bad. So you need to start off that habit to control, to help yourself so you don't get worse. And a lot of people don't realize sometimes because they have no symptoms, so they ignore it totally. But please do not do that. You got to control as much as you can. And a common symptom will be start off is really numbness, or they feel weird. I don't know how I feel. Describe. I feel kind of numbness, tingling feeling, the loss of sensation. Some people feel pain, feet and hand. That is the start of DPN. You better go get to the doctor quick because that is the kind of things that you really has to catch on quick and get control. 嗱，各位朋友記住，6成至70% 嘅病人咧都有可能有 DPN 呢個問題嘅。咁呢個咧就係佢個神經系統開始有個損毀啦。個原因就係因為佢啲糖咧可以高啊，高咗之後咧，佢又可以損毀晒嗰啲神經系統啦。咁最常見咧就話佢神經系統覺得有少即係個腳啊、嘅手啊開始有少冧啊，即係有啲冇感覺，或者一啲係刺痛嘅東西。咁同埋有咁刺痛嘅時候咧，佢手腳都有呢樣嘢嘅。咁其實咧，當有呢樣嘢嘅時候咧，你就開始見醫生發費出去，真係要話俾醫生聽你控制啦。So when you really start to have that DPN, you got to catch early, talk to your doctor, and make sure you don't let it to continue to nerve damage because you have to slow down this progression. Because if you don't slow down this progression, it's going to get worse, and you don't want to do that. And certainly you have to watch for any kind of infection of your feet to make sure care your feet daily, as I mentioned to you, soak your feet, massage it every day, put ointment, and then you have to have wearing proper shoes because if you don't wear proper shoes, you might be a big issue because the foot can cause injury. You don't have leather shoes that are rough, that cause blister and don't get well. That's bad. So wear shoes that with a big round forward, so it really doesn't have, give you a lot of protection. Wear socks, and you have to watch out DPN also from other body part because it may affect the eye, different body. You will see, and you have to continue to control your blood sugar, drink Lowsutea, and control the three high, meaning your sugar, your cholesterol, and your blood pressure. So those are the things that you now need to set the objective to get that done. 各位朋友，記住，你一定咧依家要開始咧，要如果有問題，記得叫醫生啦。你 nerve damage 係只能夠控制，唔可以俾佢繼續差。仲有，如果你係着鞋咧，要着啲大頭鞋，同埋你每日咧就要抹沙隻腳，或者浸鹽水落去啦，同埋咧就仲有咧睇下你有冇其他嘅 infection 啊，有冇發炎啊，同埋咧仲有着好啲嘅鞋啦，同埋咧要 watch out 你個其他身體上咧都有可能 involve 眼啊，其他地方都會有嘅。最重要，最後飲去糖茶同埋控制血糖，等佢唔會高。就三高咧，即係話血糖高、膽固醇高同埋你血壓高咧，呢啲全部都令到 DPN 嘅。OK 嗱 ，so it's really good. So I hope that I hope that will answer all your questions. That actually there's some question. Very nice, Eugene always ask good question. Let me ask one other question that when should I answer from question upward? Okay, when should I see a podiatrist? Okay, actually, it's a good idea to see a podiatrist, especially you have to cut your. Actually, you need to actually check your podiatrist even as early stage, because sometimes I notice a lot of people, the toenails are not so good already. They start to have a lot of things that will come occur. So you might want to check that out real quick and see that is there any area your toe start getting really deformed. So you should, when you are especially age 60, 65, you should actually start early. So it's not when you see it, you should actually have one already start out, and then determine how bad you are started, or you should continue monitor. Usually doctor will be asking you to see at least every half a year to a year, especially you start getting, your toes start forming weird looking, and that is very much need to have to check. 嗱，各位朋友，幾時去揾個腳醫咧？可能政府醫生都 OK 嘅，因為佢見到嘅時候咧，就好多時咧就要你開始去見腳醫嘅時候咧，就睇下你每半年或者1年咧就可以睇呢樣嘢。咁好多時咧，因為你自己唔知道係咪個腳嘅即係腳趾有咩問題啊，每一隻腳趾有咩問題啊，咁呢個係要由個腳醫去睇你嘅。咁可以，所以有陣時咧，你俾醫生睇之後咧，就可唔可以俾我睇下腳醫啊？呢個係重要嘅。So important that you have to really ask the doctor refer you to a podiatrist. Should be checked every half to 1 year, because when we get older, your foot start changing a lot, especially toenails grown, overgrown. All that might need a podiatrist to help you out. So you should actually check at least half to 1 year. Now, does compression socks help? Yes. As you know, a lot of the diabetic has, they call it diabetic compression socks. It helps you to actually increase the circulation and has a thick sock to help you to protect the toe. Those are very good things to help you. And so it will be actually good to give you that additional protection. So always wear socks all the time will help you. 嗱，着襪咧係好嘅，因為襪咧係幫助你咧係能夠令到你啲腳咧係會更加好啦。咁呢個咧係會係幫助你會 prevent 防住你整親嘅。咁所以着襪咧，同埋依家有啲叫做糖尿病襪咧，係會箍住隻腳更加好，能夠增加你嘅 circulation 嘅，即係血液循環啊。咁係會好嘅。咁呢個就會 be good. Okay. Now, the depression drug and seizure drug, I think you need to talk to the doctor, because that is the drugs actually doctor will be recommend. So should talk to them. Now, let's talk about circulation problem. When you have circulation problem, usually the thing is your foot become very cold, you have no feeling, and so the circulation really you can see your leg will start changing even in color, look whitish. Those are the signs of circulation problem are start getting occurring. And so you need to start getting massage your foot, moving your foot, push, this motion on your foot and allow the circulation going down. So this is massaging can help, so this is so important. So always try to get your foot massage. I know a lot of people also using a foot massage machine nowadays. Those are good stuff. So as long as you do the massage, not overdoing it, but massaging your foot is important to help you to improve the circulation. So do that, okay? Circulation, make sure that the foot be not cold and look colorless. That's not good, okay? Now, 各位同學。有個 question 就係，哇！我點知隻腳唔夠血液循環啊？咁首先隻腳咧就會開始凍啦，同埋冇乜感覺啦，同埋蒼白啦。 咁其實咧要開始去 massage 隻腳嘅，massage 腳喺個手去 massage 就得，好多人揾個機去 massage 就得，但係呢個一定要 massage 揸佢，咁將血液循環咧，咁你感覺上咧亦都感覺到咧係好重要嘅。咁其實如果你就算或者你腳板底按摩唔到咧，你叫你老公啊、你朋友啊同你按腳啊都 OK 嘅，或者揾個 machine 機器按腳亦都 good 嘅。呢個係一個好重要嘅要做一個重要嘅，每日都要做嘅。massage 腳其實係每日都做，唔係隔日做，每日都做。因為 massage 腳每日做咧，就令到你個 circulation 好啲嘅。So when you want to go to a neurologist, I think you gotta really ask the doctor to do that because a lot of doctors will start using a little piece of paper to make you feel the bottom of the foot. Do you feel it? And if you don't feel it, well, then they really have to check. You really have an issue with all the nerve damage you kind of feel. So it's really dependent on the doctor to give you the neurologist to get the feel. Okay, so it really depends. Okay. On the doctor, but sometimes many doctors will actually, when you don't get feeling, they actually will refer you to a neurologist. 腦科醫生咧係好多時咧係會開始睇下你咧，個原因就係當你冇感覺嘅時候咧，佢就可以睇你嘅。咁所以變咗嚟講咧，你係要佢揾啲咩咧？揾啲即細嘅紙仔挑下你腳底，睇下你有冇感覺。如果你冇感覺嘅話咧，咁開始佢都講得話你或者需要睇個 neurologist 睇睇係咪你個腦神經系統開始有損壞啊，咁佢有冇控制到啊？呢個咧係會該開始有呢個即係開始會係提議你去睇呢啲咁腦科醫生嘅。咁so the last question is gout related DPN? Well, gout actually have a lot of crystal. Yes, it is somewhat related, but it's not the cause of DPN. Usually DPN cause of nerve damage is basically due to your blood sugar is high, and on top of that, you're going to start getting damage because the nerve of your blood sugar is high. Gout, you have gout crystal on your ankle and so forth. And so you actually will have a lot of pain usually come from that. So DPN is really caused by more of your blood sugar high and damage. So 如果你係有呢個尿酸嘅問題咧，呢個咧就多數未必係因為呢樣嘢令到你有 DPN 嘅。其實最重要嘅 DPN 都係由呢個咩發展咧？係由你高糖發展嘅。所以呢個咧係雖然係有少即係令到你腳會痛啊，因為你個地方紅腫啊，咁但係其實重要點咧，都係喺你嗰個高糖令到你血管咧，唔係血管，你個所有嘅腳嘅血管咧同埋個神經系統嘅損壞咧，都係因為糖嘅損壞同埋有 cholesterol 嗰啲一路損壞啦。咁幾樣加埋晒咧，係你嗰個即係神經系統損壞嘅。So I hope that I answer all your questions. I appreciate everybody asking a lot of good questions. I think Eugene always asks good questions about us. That was really good. I appreciate those good stuff. So I hope everybody start looking, taking care of foot. And next week we'll hope that we'll select a topic, get further deeply understand how to take care of foot, because I start asking, well, actually not me. A lot of customers coming back to me now asking, well, I have this problem. My foot is getting this and that. So I start realizing a lot of people don't understand how to take care of foot. So I thought that I will get a special lecture just to talk about how you can take care of foot will be really good. And hopefully with that, this whole series can help you prevent the future, any potential damage, and don't let my patient, like the Japanese older lady, which is such a nice lady. I remember her for so many years because a small little twig from her yard injured for a toe she lost her toe, she lost her foot, eventually her whole foot cut off. That is so sad. And I don't want any of you will have that. 多謝各位堂友，多謝你問嘅問題。其實我係好高興咧，有咁多問題出現啦，能夠去答到你啦。咁仲有一樣嘢咧，我希望你唔好似我個病人一樣，佢係一個好嘅日本太太啦，佢就係一個細嘅樹枝整親隻腳趾，咁 end up 咧就要斬咗個腳趾去，哇！真係陰公啦，斬完腳趾減腳，去到即係個膝頭哥底下6寸咁上下啦，佢成隻腳唔見咗嘅終歸。咁真係佢真係好陰公啦嚇，咁所以我希望你哋個個都唔會係咁啦，所以一定控制係好重要嘅。So I hope that everybody can able to really have this control your blood sugar. Most important, control your blood sugar. So DPN will actually lower the whole total risk, and you are not in that boat. And I would think everybody will be so happy to see that. So have a nice weekend. I thank you very much for your time. I know it's a busy weekend, and even you have to stay here to listen and able to learn about how to better promote your better health. I appreciate that dearly. So have a good weekend. Thank you very much. You take care and have good health and continue motivate, lower your blood sugar. Thank you again. Bye-bye.